All right, cool. And then I'm going to do the intro.
Okay.
Move a little bit closer to you. Make sure I'm not cut off from the camera. I'm a wide body, so I naturally be cut off all the time. All right, so 3, 2, 1. Welcome to another episode of Mental Health Monday with my boy Daniel. What's up, man?
Hey, how you doing, man?
I'm good. Introduce yourself. Let the folks know who you are and what it is that you do.
Yeah, definitely. So my name's Daniel Veiga. I'm a licensed professional counselor, LPC. I've been a counselor for about 12 years now. I work with individuals, couples, and families.
Okay.
Yeah.
Okay. What's the importance of being a family therapist who's black?
That's a really good question. I think for one, like having a family therapist who's different, who's used to like different family units, right? So
can you explain what a family unit is?
Yeah, so understanding that not all families are what they consider like the nuclear family. So 2 parents, 2 kids, dog, white picket fence type of thing. So being a family therapist like in this time period and understanding that families are going to look different in all kind of ways. And so I think for people of color, in the black community, because there are different families that don't look like that traditional nuclear family, they're going to want a therapist who's going to come in with that knowledge and not approaching them as if they were dealing with that nuclear family mindset.
Okay.
That also includes like not being judgmental. So
do you have to be aware?
Aware of what?
Your body language when you sit down with people.
Oh, definitely.
Okay.
Definitely. Especially, at least for my experience, like I did home visits. So
is that a different dynamic?
Very
going
much so.
To their house versus they're coming to you?
Exactly.
Okay.
Yeah. So being mindful of body language in those moments is very key because you're having to pay attention to your surroundings. Like you're watching your own 6, right? But
at all
you're
times.
reminding yourself you have a job to do.
Yeah.
And so that first impression, like when you first walk through the door, or in the case of the office, them coming to the office, it's everything.
Okay.
Right. So one of those ways that I really join with the family is talking in their language. Or you maybe are familiar with the term meeting a client where they are. And so that's the thing. Ways in which, like, if there's certain phrases that they use or whatever they call like a relative or what have you, that's part of my joining process and really immersing myself like with that culture of that unique family. Now, at the same time, I have to be mindful to not blur those lines where I maybe get too comfortable.
Okay.
So going back to the home visits, there was a time this family I was working with, the lady, the mom was having a sip of something. And I was like, oh, that looks really good. She said, yeah, you want a sip?
What'd you say?
I said, as much as I would like to, I would have to decline. But, thank you so much. It looks like you're having a wonderful time. And that's been one of the challenging things because I think for a lot of the families I work with, I see pieces of like my own family, like the family that I come from. And so be it personality traits, just the warmth. My mom's side of my family is really big. So we're very much a welcoming, like, oh, you're a cousin of them, a friend of them is like a cousin of ours type of thing. So the families that I've worked with, if they're like that, I very much I want to be a part of that, but like reminding myself, like I have this professional role. So.
You're still on the clock.
Exactly.
All right, tell me more about the family that raised you.
The family that raised me. Okay, so...
do you have more than one family? Because, like, there's the family that raised you and there's the family that you chose.
That's a good question. That's a really good question. So, I would say, so the family that raised me, my two parents, my mom is from Alabama originally. My dad is from Massachusetts.
Oh,
yeah,
wow.
2 very different worlds.
Yeah, culture-wise.
Yeah, and my dad is Cape Verdean.
What's that?
So Cape Verde, there's some islands on the west coast of Africa colonized by the Portuguese. So my last name is Veiga. A lot of people think it's a Latino name, but it's Portuguese.
Okay.
But I don't speak Portuguese, unfortunately. I do speak Spanish. So yo hablo español para los clientes quien habla español.
Okay.
But yeah. But they met in Chicago when they were in school. Yeah. And so they saw those differences really early on when they met each other's families. But like with my dad, he really joined in with my mom's family because, like I said, they're very welcoming. But when you say like the family that I chose, I would say like my church family as well. So I went to People's Congregational Church, not too far from where we are now. And so those people, I think, were really instrumental as far as like even just becoming a therapist, because of just the professionals there in that nurturing environment. So a lot of the jobs and internships that I got were through those people. And they were always really encouraging of me just moving forward, even in times like where I maybe was like, I don't know if this is the field for me and all of that.
So they reinforce what you were thinking about having for yourself.
Yeah.
What's the importance of those people backing you and reinforcing your opinion of what you may need?
What do you mean?
Having that community. Like, because you're like, I was thinking about it. That means you haven't really made your decision, but they positioned you for what you may want.
Oh, so that's the thing. So I knew I wanted to be a therapist when I was in high school.
Like high school.
Yeah.
Early.
As early as 10th, 11th grade. To what I'm speaking about, though, like the challenge was like once I was in school. And so like trying to figure out what route to take. And so a lot of people told me, well, if you don't have your PhD, you're really not going to be able to do anything. But I learned through other people that I worked with that wasn't necessarily true. So
do you think those people who are advising you were making assumptions of what you may need versus actual facts?
Yeah, well, I think it was maybe based on their own experiences, because they had PhDs themselves, and so they were kind of speaking through like their lens of experience.
Were they black?
They were.
Okay. Did that change how much you would make if you had a PhD versus the documentation you have now? Would it make a difference?
Not necessarily.
How much would a PhD program cost you if you did it?
Depending on the school, it would have probably, I'll say $50K plus. Because, I mean, it's at least 4 years, like 4 additional years.
So $200K.
Yeah.
You had $200K laying around or just...
I did not.
Okay, all right, cool. I just want to ask the right questions. Just want to frame it, but go ahead.
I did not. And so that used to be the running joke I would have in my mind for people like, are you going to pay for said schooling and whatnot?
Yeah.
But one of my supervisors at my practicum, she had told me, no, there's different things you can do with the master's provided you have the right licensure.
Yeah.
And so that was the track I did. And then as far as like trying to determine whether to become an LICSW, so that's a licensed independent social worker, or a licensed professional counselor, LPC.
I'm glad you know what I'm about to ask.
That was the next thing. Yeah, I know. Mental health is a lot of alphabet soup. I definitely will break that down.
I spoke to one of my folks who I do work with therapist-wise, and I told them that, hey, if you say what you are with letters, you have to clarify that because, like, letters are for your therapist friends or folks who are in the community. The general pop doesn't know what letters are. So sometimes you have to say what those letters mean and who it applies to. Because, like, folks just see therapists as therapists. Hey, I have a problem, you're a therapist. But, like, what's the importance of defining what kind of therapist you are before seeing clients or for people that are shopping around for the right therapist?
Yeah. So one of the biggest things, like the biggest like line I have to let people know is the therapist and psychiatrist line. So a lot of my clients will say Dr. Veiga, and I have to say to them, okay, I'm not a doctor. I'm not a psychiatrist. I don't prescribe medication.
Yeah.
But I do explain like that difference of like a psychiatrist, a clinical psychologist, there's a counseling psychologist, therapist, social worker, all those different things.
You just hit me with layers.
And they overlap.
Yeah.
They definitely overlap.
Yeah.
Because I've been called social worker, I've been called therapist, I've been called the doctor.
Yeah.
And even when I tell clients I'm not a doctor, they still will say Dr. Veiga. So that's like the first thing. Just education on how the roles are different in each of those titles.
Yeah.
But there is some overlap there. And then especially like in working in the community, like I've had to wear a lot of those different hats depending on the situation. So even though I'm not a psychiatrist, I did have to learn about like the different medications that people take, mainly like depression and anxiety.
Yeah.
Like getting to know about the side effects and all of that, so that if my clients were taking meds, I'd at least be aware of, okay, you're dealing with any side effects, and really helping them advocate for themselves and talking to the psychiatrist.
Okay, tell me more about that. Tell me more about that. That's very important.
Yeah.
Because I haven't heard a therapist yet tell me. I've heard a therapist say it's important to advocate for yourself, but I haven't heard a therapist that I've done a sit down with tell me, hey, I tell my clients to advocate for themselves and I teach them. So if you could put it in 3 steps, what are 3 steps you would say you've told a client, hey, this is how you need to advocate for yourself?
Okay. So for example, if a client who's never done med management and they're meeting with a psychiatrist for the first time, I will tell them in that first meeting, a psychiatrist will usually prescribe you something in that first appointment. You have an option of telling them that you don't necessarily want a prescription. You want to see what your options are. And having the psychiatrist educate you on those meds, side effects, and the outcome, how long it'll take, like as far as like onset of your symptoms reducing from taking the medication, which is usually like 4 to 6 weeks, depending on
that's
what it
when
is.
the medicine takes the full effect.
And that's also if the person is taking that medication as prescribed
on their regular schedule.
Exactly. So that's the first part. The second piece, if they've maybe started a medication and the 4 to 6 weeks have gone, they're maybe dealing with a terrible side effect or they feel like it's not helping, I tell them, okay, you can specifically say like what's going on with you and asking again like what your options are, and if you were to stop the medication, what would happen? Because you don't have to take something willingly if you're not comfortable taking it. But I think a lot of people have the mindset of like, no, you must take this. And it's a little different than a medication for like a somatic issue. So like if
what's
you
a
have
somatic issue?
So for example, like a physical health issue. So if you're taking medication for diabetes or heart disease or high cholesterol, like those type of things where it's like if you don't take this medication, you'll die or you'll suffer consequences type of thing. I think in a way, psychotropic medication, so medication for mental health issues, in a way that it can be applied to, I think, but it's a little different. There's a different conversation I think psychiatrists have. So yeah.
Okay. That's ironic you say that, because I think I went to go get therapy for grief about 3 years ago. It was right before the pandemic. And the psychiatrist who I sat down with prescribed me medicine, and I was like, she wrote a script, put it on the table, hey, I need you to go get this medicine. And I said, I'm not here for medicine. And I slid it right back. She's like, what do you mean? I was like, I'm here to get a therapist. Now, I was diagnosed with an anxiety disorder, and outside of anxiety disorder, what's the disorder when you have an issue with moving forward? There's like a certain word for it. I know you just probably thought of 3 different things. Yeah, the disorder I had was I had an anxiety disorder, which is probably still there. There's those 2 things haven't changed or been treated. More awareness of it, but I'm like, hey, this hasn't been treated. So like until you get it treated or you sit down with someone professional and like they see the changes, you're still that thing until further notice. That's how I think about it when it comes to mental health. And the reason that's important is I told her, I was like, hey, I'm not here for medication. I'm here to see a therapist. So then she had me sit down with a lady who she was a part of the program for grief, and that wasn't made clear to me, and they had me under the impression this would be my therapist, and she was just taking notes on what my situation was in the story to build a profile. And then when I asked for the lady when I came back, they're like, oh, that wasn't your therapist, that was one of our volunteers. And I was like, so you had me sit in a room with a volunteer to hear my personal story under the guise that that's a therapist, and that wasn't a therapist, and I still haven't received help from a therapist. For someone in that situation, what would you tell them this should be your next steps because of how that situation was mishandled?
Yeah. I think one, acknowledging not informing you, telling you specifically what was happening. I think if they didn't have anybody immediately, like normally, like they should have like done a referral process. So giving you a list of individual providers or agencies where you could then find an outpatient, what they call outpatient therapists. So outpatient refers to like a clinic or community setting, private practice. Someone who's meeting with you one-on-one, but you're not, it's not like an inpatient, you're not in a hospital or a facility receiving mental health treatment. Yeah.
Okay. You're killing the game. I just want to let
you know. Thank you. But going back to that situation, so the person, I mean, it sounds like that was the assessment they were doing.
They were doing the assessment, and she was trying to figure out like where I was on the spectrum of things in terms of like what the situation may be, what kind of therapist they were looking to put me with. But I didn't know the location that I went to. They more were about psychotherapy and nothing else. Okay. And I told them clearly, like, when you write down what you're here for, hey, I'm here for a therapist. When I said to her, hey, I'm here for a therapist. And at no point did they ever come back and say, here's a therapist for you, or we don't have that service. Right. Which for me, I became aware of. I was like, oh, no, this is just a business for you guys. You are trying to, hey, you need these prescriptions. We now have someone in the system who we have prescribed prescriptions to, but you're not giving me the thing I'm asking for, inquiring about. And I think that's very important when getting therapy isn't easy. It's not a comfortable experience. Sitting down, writing down, like the action of sitting down and writing down why you're here for therapy isn't an easy action when you write out your problem, because you're seeing it in front of you. Now it's a little bit more real than what's been going on in your head and what you've been going through. Then you sit in this room and you talk to one person, and then two people, and then three people, and you're like, hey man, this is a whole picnic basket that I didn't know I was going to be going through today. And then when you have that experience of this doesn't quite work out, what do you tell someone who's gone through all that, who doesn't have the reinforcement I have of, I have this whole brand, I understand what mental health is and what it's not, and that sometimes getting therapy is a disappointing dating game versus every time you do sit down with a therapist, you found the one.
Right. That's a really good question and point, because so when I work with clients and they've had multiple therapists or psychiatrists, I talk about that early on. And one thing, I've gotten more into the habit of like really talking about expectations in our respective work together. Without necessarily diminishing the work they've done with the previous therapist. That is more challenging when you work in when you've worked in an agency and you know the other therapists that they may have worked with. And you have a personal relationship with them.
Because sometimes you have to unbuild things that they've built with their client.
Not so much that. It's kind of not stepping on the toes of the previous person, but like letting them know that you're not that person. So that works both ways, whether the client really liked that therapist and said, well, so-and-so used to tell me this and do that, and da-da-da. But it's tougher when they didn't like their previous therapist. And if I have a personal relationship with that therapist, it's the term that they use, there's two different terms. It's induction, but the main term is splitting. And splitting is when a client is actively saying something negative about another provider that you personally know and trying to get you to side with them. And that is really tough sometimes when you as the provider agree with the client. So whether it's a psychiatrist, previous therapist, or what have you, but I've learned, I mean, of course I'm not like, yeah, you're right, that person sucks. I'm not be thinking that. But I'll say, I want to know more about your experience and why you feel this way about that person. You know, what was it about your work with him or her or them that really made you feel like you weren't being listened to, like you weren't being respected, you weren't being validated, you weren't being advocated for. And so that helps, especially if there's just that reticence that they're showing toward me, it's like, oh, you're just another person who's not going to help me. So I try to use...
What does reticence mean?
So reticence just means like holding back, like kind of being guarded.
Yeah.
And not wanting to share, maybe not wanting to even meet in the first place. And that just shows up in body language, not really saying a whole lot, or saying certain things, never directly like, oh, you're not going to help me, but how are you going to really be different from these other people?
Yeah.
And not to say, like, going back to what you were saying about the one, I mean, I may not even be that be-all, end-all for that person either.
Yeah.
But I've gotten into the habit now of saying to a client, you know, this may not be a good fit. I may not be a good fit for you. And I would want you to be honest with me about that.
Okay.
Yeah.
How important is representation in therapy?
As far as
a therapist, when it comes to your clients or how you present yourself. So we're going to start with clients, and then you can transition into how you represent yourself in the field.
Okay, so representation to clients. I think the biggest thing I want to appear like as genuine and as I can, like in wanting to help them. So especially, I mean, I do this thing. So there's this technique called amplified response, which is I'm saying something with the hope that you'll like reply almost like in the opposite of what I've said. So I used to work with a lot of teenagers who a lot of times their parents brought them in, they'd plop them in front of me, fix my kid. So a lot of times the first thing I would tell them, I bet you don't even want to be here. You don't want to meet
the kid or the parent.
I would tell the kid that.
Would the parent be in the room when this happens, or would it just be
the
kid one-on-one?
Yeah,
got you.
One-on-one with the kid. And I'd be like, you look like you don't want to be here. I know you don't want to be here. Sometimes they would say, yeah, I don't. But sometimes they would say, no, I actually do. And even though my parent was saying, I need help with A and B, I actually need help with C and D. And so a different type of relationship forms because I think a lot of kids and teens, they're used to the therapist siding with the parent and saying, well, why can't you listen to your mom? Or why don't you do what your dad said? And da-da-da. So I try to be different in that regard by really hearing what the kid has to say.
You'd like to empower the kid if possible.
Right.
Yeah.
And I've learned that can work with adults as well.
Really?
Yeah, because going back to what I was saying, if they've had negative experiences with their past providers, I'm already focusing on, tell me what those past experiences were like, because I'm hopeful that our situation can be different. If they had like mostly negative experiences.
Yeah.
So just being genuine with that, telling them, you know, this is really your space. Like, I'm here to help you. I'm holding up a mirror to the challenges you're presenting me. But, and we're working as a team, but like, you're really the one doing the work. And I always point that out to clients, you know, when they say, you know, I mean, I acknowledge when they say like, oh, you've been helpful, like da-da-da, but I'm like, no, like, you've been helpful because you want to do the work, you want to make the change. Because I agree with you, therapy is really hard.
Yeah.
As far as just having to talk to somebody that you don't really know about these different things, things that you've held on to, not really shared with other people because you're not sure how they're going to respond. Yeah. So it's a lot. It's a lot to unpack there. And I always am acknowledging that with them. Yeah.
Would you say the work that you did with children directly affected your teaching style when it comes to your other clients? Because I remember you said it helped your approach when it came to adults, but like in what style or what way would you say it helped? Because I know you're holding up a mirror, but does that mean you gave the mirror a voice or you created a space for them to be heard correctly?
The latter.
Okay.
Yeah.
Okay.
Yeah, because a lot of times if in holding up that mirror, if I'm rephrasing something or I'm giving my perspective of what they say, I'm always doing a check-in with them. Yeah. And I'm saying to them, I could be wrong. This is what I'm seeing. This is what I'm hearing. It's an opportunity really for them to also hear what they're saying And if I'm wrong, they have another opportunity to try to express it or explain it.
Yeah.
And that's where I think a lot of the teamwork comes in for the therapist and the client. But to answer your question, I mean, I think because I worked with families first, I think, so the way that we did it, because we met with kids, we split sessions. Sometimes we just met with the kid. Sometimes just the parents or caregivers. Sometimes the whole family.
Yeah.
So I think in working with the kids one-on-one, we saw like a different side of them, because a lot of the stuff that they shared one-on-one, I'd say, hey, this is something that we can really talk about in the family session. What kind of things do you think will come up? And so I think because children are a much more vulnerable population, that's why I say like they were a good template as far as helping adults, because that vulnerability almost looks the same. As far as like just having to share really personal things and wanting to get help with those things.
Yeah. Would you say, so you said we a couple of times. When you said we, does that mean that there were a team of therapists behind you, or is we talking about the room itself in terms of you, the parent, and the child?
Oh, okay. So yeah, when I was saying we, as far as like the first job I did and working with families, it was a therapist and a case manager.
Okay.
And so,
what's the value of a case manager?
So the case manager did more of the concrete things. So for example, if the family needed like rental assistance or help with like an application, looking for jobs, those type of things, the case manager helped with that.
Yeah.
But remember I was saying the thing about the different hats? There was a lot of overlap.
Okay.
So a lot of times the case manager is being the therapist and vice versa.
Are they licensed, or that would just be the role at that moment?
The role in that moment.
Okay,
Because
cool.
usually what would happen, it was very rare where we had to like split up and see two different families if they had to meet at the same time. So the case manager, what gave it that extra security is that the case manager is supervised by a licensed therapist.
Yeah.
So the tools that they're being given, it's not like they're out there winging it. They're usually
Just
using,
winging it in the wind.
Right. They're usually just kind of, okay, well, this is what my supervisor said.
Yeah.
And that was kind of the running joke, too, because at the time, my supervisor said, well, you can just blame me. You can throw me under the bus. Like, if something...
A layer of protection. Yeah.
If something blows up in your face, like, hey, that's on me, right?
Yeah.
But at the same... I think that job was really helpful too, because as far as the case manager piece, that did help me as far as like helping clients with those concrete needs. Because I actually was a job I had when I moved back to this area.
Moved back from
Pennsylvania.
Okay.
And I'm originally from Maryland, and so when I moved back
So you're a Maryland guy, or you a Merlin guy?
Maryland. No, Maryland. I'm from Montgomery County.
Okay, gotta ask. Yeah.
But yeah, I say Maryland like when I'm being funny. But yeah, when I moved back to the DC area, I worked as a residential counselor for a drug and alcohol. Well, what they call co-occurring. So there's a mental health diagnosis and a substance abuse diagnosis.
Okay.
And so with that job, I actually was doing more case management than therapy. But I did have a part-time job doing therapy for families in DC. Okay. So I was all over Montgomery
Sounds like
County
a lot of hustle.
in DC.
A lot of hustle.
It was.
Yeah.
It definitely was.
Okay. I forgot what I was gonna say, because you've been spitting bars. Hold on, let me make sure everything's fine. Because sometimes the heat goes off on these things, and be like, "Nah, we hot, boss. You don't have to shut us down.
Gotcha.
This is slavery." All right, so I think this has been amazing. So I appreciate it. Are family therapists necessary?
Yes.
Okay. Tell me why.
Yes, because I think there's so many moving parts. And so this is why, so my answer to your question is going to
That's fine.
kind of
Take
be
your
all
time.
over the place.
Take your time. Do what you gotta do.
But even when I started working with kids and teenagers individually, there's a part of me that always wants to meet with the family whether I'm meeting with the parents or caregivers once or twice one-on-one, or meeting with everyone.
Yeah.
And so I think it's necessary because there's so many moving parts there that as a family is going through their lives and there's so much going on, the therapy really is a time for them to really slow down and process how things are affecting them. So for example, if a family, like if there's like a significant death in the family,
Yeah.
they've not really had time to really talk about it and process it. Like maybe briefly in just preparing for the funeral and all of that, they might meet with, you know, like a minister or something like that in preparation or whatever it is. They might meet with a social worker or therapist once to process their grief, but they're not really meeting with someone consistently to say, how did the death in the family
build up
really impact you?
Unpacking it. Yeah.
Yeah. And so that's just like one of many examples. But I think one of my favorite interventions in working with families is the role plays where everyone in the family is playing someone else. Yeah. And
so you have them sit down and play out the role themselves? Okay.
Of like another relative. So kids are being parents and vice versa. And usually that's like one of the first times where a person is actively seeing how their behavior is impacting someone else in the household. Because it's like, oh, wait, that's how you think I act? That's how you think I sound?
Yeah. And so, for them, that's what they're saying. But for that person, it's like, no, that's real.
Yeah.
Yeah.
And so there's like a whole conversation on that. Like that is a session or 2 or 3. Because then it's like, okay, when that person is doing that, what do you think it's really about? What's going on with that?
What do you do in order to help people not take this realization personal? So
one thing, especially with the parents, and I usually...
Because parents do take it personal.
Yeah. I usually will process it with the parents in their individual meetings without the kids there. And I remind the parents, okay, y'all were young once too. I want you to really think back to your childhood and adolescence. And was everything, like, were you cooperative or respectful or whatever it was in every single scenario? And then they think about it and they're like, no. The other connection is, do you see parts of yourself in your kids? And what kind of feelings are coming up for you when that happens?
Yeah.
Are you really maybe scared or worried or nervous of how that's going to play out because of what's happened to you?
Would you say a lot of parents see their kids as a second chance to get it right, but in their second chance to get it right, they don't allow the kids to grow in the direction that the kid themselves need?
Sometimes, yeah.
Okay.
Yeah, sometimes that's definitely the case. I think a lot of times, too, the parents, they haven't worked out their own stuff. So whether it's trauma, like issues they've had like with their respective caregivers, they don't realize that that's playing out with their kids.
Yeah.
And so sometimes like they need that space just to process that on their own. But I teach them how they can have that conversation with their kids too.
Yeah.
Depending on the age.
Yeah.
Right. So that's known as normalizing. And so telling the parents, like, it's okay to tell your kids, you're human, you make mistakes too, you get mad, you get sad, but it can look different. It doesn't have to be in the way that the kid is maybe presenting it. Yeah.
I just had an amazing statement. So you said a lot of parents don't realize that they have a lot of things to unpack, right? But there are cases, even the parents who have unpacked said thing aren't getting it right when it comes to the kids.
That's true.
How do you handle those situations? Like, is there a certain approach where you're like, okay, well, you've unpacked the thing, which congratulations to you, but you are still either making the same mistakes or you're making decisions that to you is different, but it's like, no, that's actually the same thing,
right?
Just in a different way.
Yeah. So what's usually helpful, and I like jump on it. sometimes I wait for the kid to say that. Because a lot of times kids will call that out. They call out their parents' behavior. And so if they do that, I build on that. Sometimes like what I'll do, I mean, I always encourage parents to like be in their own individual therapy to really talk some of those things out too. Yeah. But this is also where the coaching comes in. So if it's a matter of pointing that out, like you're still doing the same thing type of situation, I will coach and offer alternatives in how they can like approach their kids differently. So if it's like a matter of discipline or learning how to commend their kids more, or learning how to validate them more, that's where the tools come in of like, hey, this is a different way to do that. Yeah. And usually in the session, I model that and have them practice that. But I also do the check-in. I'm like, if this doesn't seem natural for you, please let me know. And then we can figure out what like works for you. Yeah. Because I think when it comes to like tools in therapy, a lot of stuff is very much scripted, and it's very textbook in the sense of, especially when it comes to like I statements, like I feel like you are doing this, and the person's like, I'm sorry you felt that way. And so I kind of make fun of that. I'm like, I know it sounds very robotic. You can use it in y'all's language, like whatever works for you, however you already communicate. You can implement this into the communication, right? Yeah. Because it is very formulaic sometimes. Yeah, but
you're just like, oh God, the script again.
Yeah.
Do you ever, have you ever had situations as a family counselor where things got too heated and you had to separate the two?
Yeah. So the one time that comes to mind. Yeah. I actually had like a father and son fight in my office, physically. And my office was maybe
right in front of the good wood,
half of this room.
Yeah. Do you is yours open format office wise, or do you have a desk in your office when people come to meet with you?
I had a desk. Yeah.
So you had to run around your desk.
I had to my desk was like kind of like how we're set up now. Like my desk was here, so I was sitting here. They were over there. Yeah. So I had to kind of like jump over them, like kind of dash around them a little bit because my office wasn't that big. Yeah. So luckily I wasn't cornered in. But even before they started fighting, I was trying to have like the dad step out, but it was too late. So, but luckily, like our office, like we had security guards. Like a security guard came in, broke the fight up. The police were involved. It was big. I was at the office.
When police get involved, does that change the dynamic of things?
Yes and no. Okay. Yes and no. Because when I was doing home visits, we usually had to call the police, and this speaks to another issue as far as just interventions when someone's having like a mental breakdown. I know now people are getting more into the habit of having like a team come out and having at least like a social worker therapist on site to deal with the client.
Yeah, but back in the day?
Oh yeah, no, it was just the police.
Yeah. Yeah.
And so I think because
untrained police.
Yeah. Yeah. And depending on the age, the race of the person, that could play out in so many different ways. Yeah. But yeah. It definitely does change the dynamic, I think.
Do you're about to say something.
Especially as far as like the relationship that the family will have with the therapist. Yeah. Because I think in those instances they feel like the trust has been broken and there's no getting through to them as far as like the danger that they put the other people in when they reacted a certain way, especially like if they react with violence. Yeah.
Because there's no place for violence when it comes to therapy. I think there's a place for violence, but I'm different. I think fighting is a form of communication that's underexplored, but like not everyone should be the ones who are leading that form of communication. Like there's a reason a lot of men are like, hey, get in the ring, let's box it out, and it's easier to talk after a fight versus it's just words and that's it. Yeah. There's a reason women have such a strong dynamic of I'm going to say what the hell I need to say. And if you don't like that, that's fine. It's still being said. To me, that is their fight.
Yeah.
Now, roles switch and reverse all the time. But when it comes to family dynamics, especially you being a family counselor, when people get older, dealing with older parents and their children who are our age, is your approach for that different? Or is it still the template is the template?
It's a little different, and I actually I have and currently work with families where it is that instance. So adult children and their aging parents.
Yeah.
And so I think the biggest thing, the one similarity I will say is that vulnerability piece.
Yeah.
Because the aging parent is dealing with these things that are like interfering with their independence, and then the adult children's lives are changed because of the adjustments they've had to make. And so that's something that I acknowledge a lot in the sessions.
Yeah.
And really saying, like, because y'all are so in the moment, it's really hard to slow down and say, our dynamic has really changed. Like, my life has really changed. And so that's a conversation in itself, because I think sometimes that plays out in the interactions that they're having.
Yeah.
So when an adult child is saying, oh, dealing with my parent, like, they're stressing me out, like, they're always snapping at me, and it's like, well, 2 months ago they were living on their own, doing their own thing, and now they're in your home, especially if those adult children have, like, young children. So it's almost, are you almost treating your parent like one of your kids?
Yeah.
And so that's something that a lot of people will not necessarily admit out loud, but there usually is a pause there of like, I might be doing that. Yeah.
I think stuff like that is interesting because, like, so my parents, mother and father, both in Jersey, right? Both Jamaicans, point blank period. And I told him, I said, look, fam, if I get married and I'm on this side, I have no issue with getting you a house, but I'm not moving you guys into the house. And they're like, well, why not? It's like, you are used to existing in a whole entire house, having a separate space from everything that I do. And I'm the same now that I have my own space. So you moving in means you now have to readjust your space, and everyone in the house is going to have to deal with that. It's not about, oh, you're not willing to take care of me. No, I'm willing to make space for you, but you do have to be willing to see, like, what does your future in my life look like, and are you guys okay and ready with that? Because, like, you don't have a choice. Now, if you want us to sit down and we discuss and everything else, that's fine. I'm open to that. But you need to understand, you as an older person moving into someone's house after having all that space, hearsay, and everything else, as an adult, adults don't really adapt all that well the older that they get. It's very rare that you come across an adult who adjusts so well that you're just like, wow, I'm really wondering who am I actually dealing with? Because, like, the older you are, you've lost so many things that you've built a certain amount of rigidness in just existing.
And so that's where I think the family therapy can be helpful, because I think in the day-to-day life, the parent isn't necessarily saying it that directly as you did. It's coming out in maybe a lot of times like these passive aggressive ways. Or non-verbal ways. And so usually the family therapy, like those sessions, is the first time they're really saying how they feel about the situation. Now, the other thing you're dealing with, like, and I'm glad you said your parents are from another country. So I've dealt with that too, where if the parents are from another country outside the U.S., their own take on therapy itself and whatever their feelings are about it. So when you were saying the thing about, like, your shrink, and I think sometimes just the negative connotations that come with therapy, I usually see two things. There's one, this concern of feeling like they have to do therapy the right way. It's like I have to say the right thing, or it's, I'm not crazy, I don't have problems, why am I meeting with you? And so it's trying to find that medium between those two extremes. Because there is a whole conversation about just normalizing. It's like, no, this is an opportunity for you to really share what's on your mind and make you feel like you have a voice, because outside of this context, maybe you don't have that, or you feel like you don't have that.
They're shrinking the value of the process. So, like, for example, I went home for Christmas this past December, and I found out my mom doesn't, she thinks she's too old for therapy. And I'm like, Mom, your son is an advocate for therapy, for wellness, for all things. You need to sit down and be honest. Therapy doesn't have an age. My aunt, who's a nurse, looked shocked that she said that, because like we all grew up in a hospital. Like my mom worked in a hospital. I was raised in a hospital. I was a patient advocate before I was not a therapist, a mental health advocate now. I have like an extensive background of just doing medical things outside of being a doctor. So it's just like, for you to think that you're too old for therapy also lets me know you may think that you may be too old to grow. You may think, I'm an adult now and I have all these things to do, and you forget, like, therapy isn't just when things are bad, I need a therapist. Sometimes when things are good, you need a therapist, because you have a problem growing into who you need to be with the successes that you have and not just the failures. And for her to think that, I'm just like, oh man, even if I make space for you when it comes to therapy, if you ever decide to get therapy, you may not be making space for yourself. And stuff like that to me is important. That's why it's like, when you said you're a family therapist, I was like, oh, come on, come talk.
So I think in those instances, to kind of help. Oh, I thought the camera went off. To kind of help with.
No, it's still going. This one is heated. This one is like hot. But you can keep talking. But this one is like, it's going to shut down like 5 minutes. Yeah. We'll just take a break. That one's hot too, so we'll take a break in 5 minutes. But go ahead. Yeah.
So I think in that instance, when it comes to trying to get somebody to be open to the idea of therapy, the biggest reminder is you can't make them do it.
No, not at all.
Yeah. And so, but I think what can maybe help, if the person who's trying to advocate for them to get their own therapy, I do say to that client, like, if you're comfortable having that relative sitting on a session with you. Now that's more so like the family therapist in me, so I don't think every therapist would necessarily do that. Especially if like family stuff isn't like a goal for them. Yeah. But for me personally, I mean, I would just use it as an opportunity to answer questions that they may have, because sometimes it might just be talking to an actual therapist and seeing, okay, this person is personable, this person is genuine, maybe it's not a bad idea. And so just saying, like, even if you meet with somebody once, for a lot of people that can be enough. They meet with somebody once or twice and they're able to get that clarity they need. But I think when it comes to trying to advocate for someone to see a therapist, why is it that you feel that they need to? That's the thing too. So like, what is it you're hoping that person will gain from it, especially if it's someone you care about and you're thinking about their best interests, because you can use that as an approach too. Yeah. You know.
All right, we're gonna take a break right here.
Okay.
Because these motherfuckers hot.
Yeah, no
problem. I just saw it. I saw you point it out.
Yeah,
and I was like, oh yeah, nah, that's hot. That one's hot too. Oh snap. All right, cool. Go ahead.
We had to do role plays. We had to tape. Maybe like 2 sessions a quarter. We had to tape our supervisions. So like, and even though that was a different type of being on,
you had to see yourself from third person quite often. Yeah,
which is really helpful, like in training, because the one family I worked with, and they had the TV on, and my supervisor was like, "Why was the TV on?" I was like, "Shit."
That's funny as hell.
Like, okay, let's move past that. I was like, what happened to meeting the family where they were? I mean, she wasn't even the main person it was the sister who was watching the TV. So I was like, well, that wasn't the client we needed to focus on. But that was actually a unique situation, because it was a single mom. She had 4 kids, and two of the kids were deaf. The identified client was deaf. So mom spoke Spanish. So me, the case manager at the time, she was Spanish speaking. I'm bilingual. We had to have an ASL interpreter. And
is bilingual an advantage in your profession?
Oh yeah, like for some jobs I got a pay raise just for being bilingual. and I didn't even have to use Spanish. Like, I remember one time it was like, yeah, I'm bilingual. She was like, hey, raise. And I was like, I never had to use Spanish. Like, at all. But I think it's a benefit as far as just like the comfort level too. So when I worked at Mary Center, it's in Adams Morgan. So 70% of my caseload was Latino. 50% of that was Spanish speaking only. And so that was actually something, I mean, I would get complimented on my Spanish and not sounding like, you know, hola, como estás. So a lot of people would be like, where are you from? Like,
they're like, thank you for not sounding like barbecue on a burrito. I got you.
Exactly.
Yeah.
Exactly. So that, I mean, I think that helped with comfort level too. So it wasn't necessarily, I mean, benefit for me, like as far as just the job itself, getting a raise for being bilingual and all that, but I think just my work with Spanish-speaking clients, there was a comfort level there. Yeah.
Well, shout out to you. Did that ever backfire? Did being bilingual ever hurt you in your profession at any point where it's like, well, you said you're bilingual, so you should be able to, and you'd be like, no.
Yeah.
I think the answer to that is no.
I think that happened more so with the clients. And so
how so?
So with Spanish, what I learned, because I was taught in college I was taught mostly by Colombians. They claim to speak the best Spanish because that's where they make the rules for Spanish.
So is that elitism right there?
Very much so.
Okay, cool.
Very much so. But, you know, most of the Latinos here are from Central America or like the islands. Dominican Spanish, I cannot understand for shit. Puerto Rican Spanish, I mean, it's faster. So sometimes certain turn of phrases and things, like, I'm not quite catching. So it's very much, you didn't help me because, and you claim to speak the language, and da-da-da-da-da, and you don't know how to help me, and da-da-da, and it's like, okay, what's the real issue here?
Let's slow it down.
Right. Yeah. There was a situation where you didn't feel validated. And the reality was I probably just set a boundary. They probably wanted me to do something that was out of my scope. Yeah. And I was like, no, I'm not doing that. Yeah. So, but I think that was like the easier go-to.
For them.
Yeah.
Okay.
Because then...
low-hanging fruit.
Because even though I was bilingual, it's like, well, you're not Latino, you're not Dominican, you're not Salvadoran or whatever it was, so it's not like you're really trying to help me. Yeah. You just happen to speak Spanish.
Yeah. So they were trying to fit you in this role, and you're like, well, I'm more than the role that you see me in. And you didn't say this out loud, but it's like, fam, I hear what you're saying. Who else is going to help you in this room outside of me being here right now? So how do you stay confident in those moments? How do you believe in yourself? So
I mean, like, I'll admit, I think even with clients, I mean, and that took some time, like, I'll admit where there's weaknesses or things that I, like, genuinely cannot help with. Yeah. And so if it comes down to, like, specific mental health things, I will refer out. So, for example,
I don't refer out mean?
Like, send them to a different therapist. Or have them go to, like, someone who specializes in a specific therapy. So if it's someone dealing with, like, a trauma, I'm not trauma oriented in the sense of, like, for example, working with somebody with PTSD. So I might send them to someone who's trained in, are you familiar with EMDR?
I've heard it.
Eye movement desensitization. So that's not a talk therapy. It's used to really focus on the trauma and helping the client learn how to let go of the trauma versus talking about it and having them, like, rehash that trauma in a session.
So would they go to that person who does that and then, like, 6 months later come back to you
if they
after that's been broken down?
If they wanted to, yeah. Usually what will happen, clients... I mean, if that's, like, the last thing, like, if that's the thing that they feel they need to focus on, they usually won't come back to me or, like, another therapist for talk therapy. Yeah. But, yeah.
As a family therapist, have you ever had to deal with domestic violence?
Yes.
Okay. Yeah. Would you like to speak on that?
Like, as far as, like, how I dealt with it or addressed it?
It's up to you. I'm just, like, you know, that just came in my head. I was like, as a family therapist, I think I should ask, like, hey, have you dealt with domestic violence, and like, what has that role, which is your role, look like for you in terms of like, I do need to help this person, or the information I'm getting down here says abuse, especially when it comes to people not understanding. That is abuse.
Yeah.
What you've just described is abuse.
Yeah.
This is an abusive relationship in your family. Like, what does that?
Yeah. So yeah, no, we definitely can talk about that. So I will clarify. So like, because I work with couples too. So in couples counseling, if there's
this is major. Keep going.
if there's active domestic violence, usually I won't keep meeting with the couple. I've not had that experience. I haven't had that experience where there's active domestic violence. Like, yes, there's maybe been physical altercations, but they're able to say like why that altercation happened and what they're doing to prevent it from happening.
If they're not able to say that, you're just like, this isn't gonna work.
Right.
Do you have to report them to someone?
So no, because it's one of those things. So I haven't. I'm trying to think.
This is where yellow tape comes in.
Yeah. I'm trying to think with families. I've not had to do like a mandated report, like an adult abuse report, because usually it's the domestic violence is kind of like the aftermath of it, or it's like resurfacing. Yeah. And so with one particular family I work with, so I wasn't the mom's individual therapist, but I let her individual therapist know what was happening and then informed her of services that she could utilize.
So you work through the community.
Right.
Okay.
Yeah. Okay. But as far as like actively making a report on the guy, I didn't do that. Like the individual therapist that she had may have done that.
Okay.
Yeah.
When it comes to kids.
Oh yeah, I've had to make many a report.
How is that categorized?
With the mandated?
Yeah.
So even if a kid says my parent or my caregiver is hitting me, I have to make a report. I mean, like, I have a conversation and get as many details as I can from the kid, but I make the report to seeing, like, a parent hit their kid, like, in front of me, which that...
I mean, you had the dad and the son fight, but I don't know what age those folks were compared to what you're talking about now.
Yeah, so that was different. I mean, the situation... I mean, I've never seen a parent actively like beat like whoop their child's ass, like spank them and what have you. And in those initial situations, because I was just becoming a therapist, I talked with my supervisor. I was like, well, I'm not sure how I should have handled that, because to make a mandated report, like, it's not leaving a mark or what have you. But that's when I learned, like, you got to make a report regardless when it's anything.
Yeah, period. Yeah. Okay.
And I remember I had made this joke. I was like, were they doing that in the 80s? And my case manager was like, are you serious?
I mean,
but I was for real.
Nah, you have to ask the question, because it's like, I think our community, in terms of Black, therapists and counselors were a doorway to, hey, these people are going to take our kids away.
Right.
And that doesn't go away. Like, even what you've just said says, hey, there's a good chance your kids might get taken if you get this person help and you're the problem. Yeah. You being the problem is, that doesn't just go away, because we're working on it. Right. And it's unfortunate. Being human, being human takes time. So when you find out what your trauma is, or what your situation is, or what the problem may be, you having the solution doesn't mean you having the solution, you just upgrade and the solution's in there. You have to literally dismantle habits. And sometimes your habits aren't you. Sometimes your habits are the people that are around you, that internally you're like, no, I need these people. They're my support group. And your child is like, actually, you don't need these people, because they've done this, this, and this. And this has made you, as the adult, make this environment. So when it comes to the adults that you sit down and you talk with, how do you coach the superior, I guess would be, in terms of the adult or the parent, into creating a better environment? How does that come up in your work in terms of environment improvement? Like, what would the words for that be?
Environment improvement, like their living situation, or
not the living, like emotionally. Like, hey, you do need candles. This place stinks. Hey, you do need better language etiquette when you're talking to your child. Yeah. That is playing into things. The verbal hygiene.
I like that. Verbal hygiene. you should copyright that. That's a good term.
Appreciate it.
Yeah. So that it's yes and no, because one is like there's a way of approaching it where I have to be mindful that I'm not coming from like my own
background and resources.
Right? Exactly. Yeah. Of like, oh, this is how this should be. But it's more so when you're speaking to your kid like this, what do you think they're hearing? Like, how are they receiving that? Like, what are the words that they're really picking up on? And so those are the powerful sessions. That's what I was saying. Like when the kids call it out, usually that's like the first time it might actually click for the parent, and the parent's like, oh, I didn't even realize that. I didn't realize I was doing that. Like, and it's very much like that's how my parents talk to me. So that's why I'm doing that with you. So then that's where like the modeling comes in, as far as just these are different ways that you can say it. I always push the I statements. I always say, when you're making like a direct attack against somebody, there's usually like a need that's veiled underneath it, and that need isn't being met. Yeah. But you don't want to show that vulnerability. You don't want to say, I'm, not even so much like I need help, but like I'm scared, I'm worried, I'm this, I'm that, because that's usually what's playing out. But it's usually the parent's own individual issues. Yeah, they're taking it out on the kid. The same job in Pennsylvania, my supervisor, she did this really good job pointing out. And this was a family I was like really stuck with. The mom was an alcoholic, and a lot of times we would get to the house, she would be like drunk, passed out, whatever. And so my supervisor had said, "Well,
when you say stuck with, define
stuck in the sense like I wasn't sure how to help them."
Okay, because I didn't know if you were like, my heart's in it, I don't want to let them go, but this is a mess.
Oh no, I wanted to close out with them. Like, the boy got on my nerves every day. But no, so stuck in the sense like I wasn't sure what to do with them, because the mom at times like was receptive, but then she'd retreat back and be like, I ain't dealing with these kids. But my supervisor had said, well, the kids' behavior, maybe they feel like they have to act out because it takes focus away from the mom and her being drunk and maybe looking like an unfit parent. And the thing was, like, she wasn't. I mean, she
wasn't a fit parent?
No, she was a fit parent in the sense of when she was sober, she really was looking out for the kids' well-being. But the kids were very much taking care of themselves too, because they didn't know when mom would like go, whether she was drunk or not. Like they weren't sure, like, is this a good day? Yeah. Exactly. Yeah. And I think 2 of her sisters were there. So I mean, like, they had their 2 aunts. Yeah. It was a big old blended family house.
Yeah, no, I got you. Is that what a blended family house is considered?
That it can be. That's like a form of it.
How long would family members need to be in the house for it to be considered a blended family?
I would say, honestly, like 3 months.
Oh, I've lived with 4 blended families. Yeah. I mean, when you're Caribbean, that's just how it is. Yeah. When they come up, they stay in your crib usually half a year to a year. And I guess I'm just accustomed to it, because I'm just like, nah, that's your family. If you're not gonna help them, then who is? Yeah. And I think getting used to that, I kind of had to unpack and unbuild that as I grew up. Was like, yeah, but you do need your privacy. You do need your space, and you can't help them unless you're helping yourself. So I get it. Nah, my bad. Go ahead though.
What?
Just the family. Yeah.
Yeah. No. So blended family. I mean, I think it can be whether it's extended family living with that family or like step half, however you want to phrase that, because I think a lot of times people won't say that's my stepmom, depending on the type of relationship. They might say like, oh, that's my mom. Yeah. Whereas they're calling their bio parent maybe by their first name, depending on the relationship.
Yeah. When I came across that, I was like, so you call your parent, your mom, by their first name? Oh, wow. The most I'll do is Miss Jones, last name, but the first name, wow, okay, bet. No, that's, to me, that's always fascinating. But, okay, so earlier you spoke on being bilingual, especially when it comes to your work. How do you deal with racism as a therapist? Especially when it comes to other cultures, because certain cultures, racism, that's just a part of their culture. It's just another day. It's not personal.
Right.
But you're black. You're a black therapist. So if someone calls you negro, and it's not the color.
Right.
Like, how do you deal with that? Especially when sometimes this may come up like 5 months into the relationship, and you're like, wait, have you been internally calling me that this whole time? Like, how do you deal with that?
So that has come up. Okay. And a lot of times it's very much, and I think you had mentioned it earlier, like if it's that person's experience with black people, that in a way has like kind of mirrored, or actually not mirrored, pardon the term, but colored their sense of black people, as a whole. And so usually me working with that client might be like the first time that they're dealing with like a black like professional, like in that regard, where they're being vulnerable and they're in that open space.
So who's trying to care for them.
That's who.
Yeah.
And there have been times where they may slip and say like, oh yeah, because like black people, well, not you. Like that, like that's happening.
One of the good ones.
Basically.
Yeah.
There, like one case that sticks really out in my mind. This woman, she had been robbed at gunpoint. She lived in Baltimore, and she was mugged by a black man, a young black man. Yeah. And so she had said, I think like in those initial sessions, well, I mean, I'm not like afraid of black people. I mean, because you're black, and I mean, you're different. You're not gonna rob me. And so that became just a conversation in the sense of like, okay, but what's your take on the people? Because like if the person who mugged you had been of a different race and I was of a different race, do you think you would have said the same thing?
Or would you have continued to carry that with you? Yeah. Because like, the way folks in her mind, they're going to rob me at gunpoint. But, for you, when you are... They're gonna rob you in your checking account and rules and policies and everything else. So It's like, robbery is robbery. Now the experience does define the impact of what happened to you and the vividness of it, but that doesn't change other cultures doing wrong by you. Have you ever had to explain that to a client?
Yeah.
See, now that we're having this convo, I see why on the phone you're like, you sure you don't want to be a therapist?
Yeah. Right. Because it's a matter of validating the experience. Like that in itself is the conversation. And then with the race piece, it's two different things. So like really helping the client to see these are two separate things that you're talking about, but when you blur them together and you say it out loud, it does come across in a different way. Yeah. And depending on who you're talking to, not everyone's going to respond in the professional way that I'm responding in. And so it's been helpful that I've been in spaces where, especially like the last place I worked, there was a good amount of diversity as far as the clinicians. Yeah. And just having other black therapists there as that sounding board was a great resource. I mean, that is such a benefit because a lot of times we've all dealt with at least one client who said like, you're one of the good ones. If we're working with a different race,
that will never not hurt. Yeah, when people say you're one of the good ones. Yeah, that's man, that I'm sorry.
Because the thing too, no, you're right. Because the thing is, what do you define as a good one? Because especially in that context, because you're only seeing me in this therapy framework. Yeah. So, but really nothing about my outside life. So how do you know I'm one of the good ones?
You just know what I'm paid to be.
Yeah.
Yeah. Nah, I got you. does being bilingual sometimes hinder you in terms of people wanting to open up to you? Like, do people view you being bilingual as a therapist as, well, it's a part of his job? Or do they view you being bilingual as, this man really wants to get to know my culture and know me when he has a chance to talk to me?
Yeah, I think more so the latter, because I think in the beginning, someone who speaks their language, there's a sense of connectedness there, because it's like, okay, someone who speaks my language, because a lot of times they maybe dealt with providers who weren't bilingual and they maybe needed a translator. And things get lost as far as like just the rapport building there, because that translator, one, isn't necessarily always translating verbatim the client's needs to the provider. So I think for being a bilingual therapist, the client is like, okay, I really can express my needs. And maybe even when it comes to these other providers, you can help me advocate and communicate with these other people what I need. Specifically in the case of like a psychiatrist. And if they already have hesitation about being on meds and all of that, they can at least talk with me about it first. I can relay that to the psychiatrist.
Do you think meds are necessary?
I think
they have their place. I think they have their place, but like, I don't think it's for everybody.
No, I agree. And I tell clients, I'm pro medication in the sense of like, if the person themselves, they feel they're using it as like an additional support. So I'm never like, oh, you should take medication. There's a medication for that. Like, you should take it. Like, I'm not a drug rep. I'm not.
Have you worked with someone who was like that?
Yeah.
Where it's like every day it was like, oh, there's a medicine for that. You're like, hey, let's slow down on the pill popping. All right,
I'm not getting commission from Pfizer or anybody to like push a med. But and that's why I say, like, when they meet with a psychiatrist or medication provider for the first time, I always say to them, talk about your options first. They're going to write a script 9 times out of 10 based on what you present to them. But it's okay to say, like you had said in your experience, I'm not here for that. Right. Slide it back.
No, thank you.
Right. I'm not here for that. I really want to just talk about what my options are. In a few instances, so clients who are maybe more into like a holistic approach, I'll admit, like, I've had to do more research just to see what's out there, especially in the community. And a lot of times the clients, they're actually teaching me about what those alternatives are.
Like really cannabis, but with moderation.
Well, yeah, not even cannabis, because right now, I mean, with it being legal in DC, for DC clients, it's actually easier for them to get a card and all of that. I think it's overused, but it's
necessary. Even teens? They're allowing teens?
Teens, If they can get like the parent or guardian approval.
Really? Wait, so there's teens out here smoking J with like parents' approval?
With a card,
Okay. Like, what age is that?
I think it's 14.
Really?
Might be 16.
That's fascinating. Is that a recent development?
That, at least within the last few years.
Okay.
Because one interesting thing about mental health, like as far as the consent, so like a 14-year-old actually can consent to treatment or not when it comes to signing the applications and stuff. So a parent
by themselves, they don't need a parent for that.
Correct. Wow. So a parent could bring in a teenager.
Is that just a Maryland thing or a nationwide thing?
I want to say it's in most states.
Are you from Maryland, DC, in terms of what you're certified for?
Yes.
Where you could do work?
Yeah, I'm licensed in Maryland and DC.
Okay, just important question. People love that. They're like, oh, I can see my nigga, he's in DC. All right, cool. My bad.
I am currently licensed in Maryland and DC, soon to be Virginia. I'm working on Virginia.
Okay, cool.
But even
so you're almost at the V in the DMV.
You're right.
I got you. Okay.
So even when I was in Pennsylvania, the parent, so even though the parent was there for that initial session, if the kid was 14 or older, they could sign the paperwork. Okay. So essentially a 14-year-old could say no to treatment. And in that instance, sometimes it is more a conversation with the parents of like, hey, what's happening? Now, because they're still the parent and guardian, they can sign it. Of course, I usually will still meet with the kid. But I'm usually doing more joint sessions with the kid and the parent to kind of figure out why this kid is so hesitant in meeting.
That's awesome.
And really just encouraging a conversation with the two of them.
You just dropped a gem on that one. You dropped like 5 answers, and I was like, wait, word? Wait, so I need to reach out to someone. You got some folks I need to talk to? Because like that's important. Knowing kids' rights when it comes to mental health, that's super important. I have a couple of kids that have reached out to me that I came to realize pay attention to my content, and like I'm very big on like, hey, I'm always surprised when I make content and that person to me isn't seen in the content, but they say, hey, what you're making, I need that. Can you make more? Or is this topic that you can create education around that'll be easier for me to understand? And I'm like, fam, you are 17, you are 16, you are 15, but it's like, nah, they want that. Yeah. They have questions. And I don't want to create this platform's for everybody. No, you're not as good. It's too much. It's too much. You don't want to generalize too much. Yeah. But when that does happen to me, it's like their opinion matters, and it's important, because if they're reaching out to me, they may not have anybody else that they're able to reach out. So I'd rather get it right now instead of later. So where can the people find you?
Okay, so right now I am on Instagram. Daniel Veiga.
You just started.
OPC.
You just started. It's new on that
Page
side.
Page is fresh. Slowly adding content.
How long have you been doing this work?
How long? Yeah. I've been a therapist for 12 years now.
Okay, so therapist 12 years. Social media is fresh, but you 12 years deep.
12 years in the game.
Okay, yes. Cool. Yes. Got you.
And are you going to show the link, like my Psychology Today profile?
I'll just have it in the YouTube, if anybody wants to find you.
Yeah.
When you shared that with me, I was like, I appreciate that. This is a great gem.
Yeah. My Psychology Today profile speaks specifically on the populations I work with, and then the approaches I use with my clients. Yeah.
Okay, cool. What's one piece of advice you would give to someone who is interested in family therapy?
As far using it or becoming one?
Let's go with the first, and then we'll do the second.
So utilizing, okay. So ask your question again.
What's a piece of advice you would give to someone who would seek family therapy?
Okay. So the most important piece of advice I would give is really being mindful of the family as a whole and what you're hoping to gain from the service. So even because usually with family therapy, what they call the identified client, so the focus in the sessions is usually one of the kids. And so not just saying my kid is acting out or my kid is doing A, B, and C, we need to meet to fix him or her. No.
Is there something wrong about saying fix?
Well, I say fix. People don't necessarily say fix. Yeah. But that's the message that comes across. When a parent is usually saying, I can't get my child to do something and I need help. But a lot of times as the therapist, they're saying, I need you to tell my kid what to do. Right? So it's coming out in these different ways. But again, the vulnerability piece. The parent isn't necessarily saying, I am scared that I don't know how to help and support my child anymore because I've tried these different things. Yeah, so
nothing's working.
And that's where I say, with the family stuff, it's a lot of moving parts. It's not just the kid. Yeah. So if it's you want to learn how to improve communication with your kid or understand them on an emotional level, saying those type of things, I'm more likely to respond to them positively in the sense of okay, you admit that everyone in the family needs support in some kind of way. And it's not just because your kid is acting out type of thing.
Yeah. Okay. What's a piece of advice you would give to someone who would like to become a family therapist?
Buckle up.
Okay.
Put on a helmet.
Okay. Do you think there was any advice that someone gave to you early on that really not took you on this path, but helped you in your darker times when it came to, am I really cut out for this?
That's a good question. I would say, so the very first supervisor that I had, and so when I was in Pennsylvania doing family therapy, that was my first job. Yeah. And so there were definitely those times of imposter syndrome, just in the sense because I had never really done therapy. I'm doing home visits. Yeah. I'm seeing kids throwing stuff, pushing their parents, pulling out knives, all these different things.
A little shake.
Yeah. And I'm like, I don't know what to do. And so her telling me, I mean, she had said, like, I was nervous, like, when it came to hiring you because you didn't have experience, you were fresh out of school, and I could tell your first few months you were terrified. And I was like, I was? she was like, don't try to front.
She had you pegged?
You were terrified.
Yes. She had you pegged. Okay.
She did. Yeah. She did. But she was like, but there was like, there was something in your eyes there that like showed that you were genuine and you really wanted to help these people that the best you could.
Yeah.
And so I think for that, like her reminding me, you know what your purpose is in coming to see this family, and knowing it's not like this quick fix of, oh, you're misbehaving, okay, start doing these things, or just telling the parent, ground them for 2 weeks. And that was like really helpful for me to hear. But she really helped me just grow as a therapist as far as like looking at things from as many perspectives as I can. So like the example I had used with the mom who was drinking and saying, well, are the kids' behaviors a way of taking attention away from the mom? And looking at it even deeper in the sense of, in a way, that's keeping the family together. Because maybe the kids were concerned that social services would come and take them away if they deem mom as unfit. When the reality was, social services could see if she could get support for her alcohol abuse.
Yeah.
So